Welcome to the first section of our exam preparation course. In this opening lesson, we will explore the essential foundations of physician-based documentation, including medical terminology, human anatomy, pharmacology, and health record structures. Understanding these core concepts is incredibly important, because they form the absolute basis of everything a medical coder does on a daily basis. I am excited to guide you through this material because mastering these basics will make the advanced coding rules much easier to understand later on. Get comfortable. Take a deep breath and let us begin building your coding expertise. Every profession has its own language, and healthcare is no exception. Medical terminology is the universal language that doctors, nurses, and coders use to communicate accurately about the human body and disease processes. For the exam, you do not need to memorize every single word in the dictionary, but you must understand how medical words are built. Most medical terms are constructed using prefixes, roots, and suffixes that originate from Greek or Latin. By learning the most common word parts, you can figure out the meaning of complex medical conditions you have never seen before. Let us look at how these word parts function together to create meaning. The word root gives the core meaning of the term and usually refers to a body part like the heart or the stomach. A prefix is placed at the beginning of the word to modify its meaning, often indicating location, time, or number. A suffix is added to the end of the word root to indicate a procedure, condition, or disease. For example, in the word pericarditis, peri is the prefix meaning around, card is the root meaning heart, and itis is the suffix meaning inflammation. Since you will be reading clinical notes all day long, a solid understanding of human anatomy is absolutely required. The cardiovascular system is a frequent topic on the certification exam and involves the heart and blood vessels working together to transport oxygen and nutrients. You need to know the basic flow of blood through the 4 chambers of the heart and out to the lungs and the rest of the body. Many physician procedures are categorized by which specific artery or vein is being treated. Knowing the difference between the pulmonary artery and the aorta will directly impact your procedure code choices. The respiratory system is another major area you must know well for physician coding. This system includes the nose, trachea, lungs, and the tiny air sacs called alveoli, where gas exchange actually happens. Physicians often treat conditions like asthma, pneumonia, and chronic obstructive pulmonary disease, which all affect different parts of the respiratory tract. When you read a pulmonology report, you will need to identify exactly which lobe of the lung was biopsied or examined. This anatomical detail is what allows you to choose the most specific diagnostic and procedural codes on your exam. Moving on to the musculoskeletal system, this area can be quite challenging due to the sheer number of bones, muscles, and ligaments. Orthopedic coding requires you to know the exact names and locations of major bones like the femur, tibia, radius, and ulna. You also need to understand terms of movement such as flexion, extension, abduction, and adduction. A surgical report for a joint repair will use these specific movement terms and anatomical landmarks to describe what the surgeon actually did. If you do not know the anatomy, you simply cannot code the surgery correctly. Pharmacology, or the study of medications, is another crucial piece of the documentation puzzle. While you are not prescribing medicine, you will see drug names constantly in patient charts and medication administration records. It is highly beneficial to recognize common drug classes like antibiotics, antihypertensives, and analgesics. Understanding what a medication is used to treat can give you massive clues about the patient's underlying diagnoses if the provider forgot to state them clearly. However, always remember that as a coder you cannot code a diagnosis based solely on a medication list. Now let us discuss the structure of the patient health record itself. The medical record is a legal document that tells the complete story of a patient's healthcare journey. In a physician office setting, this record contains registration forms, medical history, physical examination findings, progress notes, and test results. Each part of the chart serves a specific purpose and provides different clues for your coding process. You need to know exactly where to look within this massive document to find the specific details required for the exam and your daily work. The most common format you will encounter in physician documentation is the SOAP note. SOAP stands for Subjective Objective Assessment and Plan. This structure helps providers organize their clinical thoughts and gives coders a predictable map to follow. Understanding this format is a massive advantage when taking your exam, because many test questions are presented as mini SOAP notes. You must know which information lives in which section to extract the right codes efficiently without wasting valuable testing time. The subjective portion of the SOAP note contains information that the patient tells the provider. This is where you will find the chief complaint, which is the main reason the patient came to the clinic that day. The subjective section also includes the history of present illness, where the patient describes the severity, timing, and location of their symptoms. It is important to note that subjective information is strictly from the patient's perspective and cannot be objectively measured by the doctor. This section is excellent for finding symptoms but rarely provides the final confirmed diagnosis. Next is the objective section, which contains the actual facts and measurable data gathered by the healthcare team. This is where the provider documents vital signs like blood pressure, temperature, and heart rate. The objective area also houses the detailed findings from the physical examination, where the doctor looks, listens, and feels different body systems. Laboratory results and radiology findings are also documented in this section. For coding purposes, the objective section provides the clinical evidence that supports the final diagnosis and justifies the medical necessity of the visit. The assessment is the third part of the SOAP note, and it is arguably the most critical section for diagnostic coding. This is where the physician provides their medical opinion and lists the final diagnoses or suspected conditions based on the subjective and objective findings. The assessment bridges the gap between what the patient felt and what the doctor discovered. On your certification exam, the assessment section is the first place you should look to find the primary diagnosis code. However, you must ensure that the conditions listed here are fully supported by the rest of the clinical note. The final piece of the SOAP note is the plan, which outlines what the provider intends to do next to treat the patient. The plan section includes medication prescriptions, therapy referrals, patient education, and instructions for follow-up appointments. It will also list any minor procedures that were performed during the encounter or scheduled for the future. From a coding perspective, the plan is essential for capturing procedural codes and understanding the complexity of the medical decision-making process. A highly detailed plan usually indicates a higher level of physician work and a potentially higher code. Beyond standard office visits, you must also be comfortable reading operative reports for outpatient surgical procedures. An operative report is a highly detailed document created by the surgeon that describes everything that happened during a surgery from start to finish. These reports contain a header with the preoperative and postoperative diagnoses, which are crucial for your diagnostic coding. The body of the report contains the step-by-step description of the surgical technique used. You must read the entire surgical narrative to ensure the procedure code matches exactly what was physically performed. Diagnostic test reports such as laboratory results and radiology interpretations are also common in physician documentation. A radiology report is written by a radiologist who interprets images and provides a final impression of the scan. As an outpatient coder, you can often use the radiologist's final impression to code a definitive diagnosis if the attending physician has not provided one yet. However, laboratory results like blood tests cannot be used to code a diagnosis unless the treating physician explicitly interprets those results and documents a related medical condition in their own note. A critical concept in health record documentation is authentication. Every entry in a medical record must be signed and dated by the provider who provided the service. This is a strict legal and compliance requirement that you will definitely be tested on. An electronic signature is perfectly acceptable, but stamped signatures are generally not allowed by insurance guidelines. If you are reviewing a chart for an exam question and the provider's signature is missing, the document is considered invalid for coding purposes. You would need to query the provider before assigning any codes. One of the most important concepts you will learn in this course is medical necessity. Medical necessity simply means that a healthcare service or procedure is clinically justified and appropriate for the patient's specific illness or injury. In the coding world, the diagnosis code explains the why and the procedure code explains the what. Insurance companies will only pay for the what if the why makes logical clinical sense. As a coder, your primary job is to ensure the documentation clearly proves the medical necessity of every single service being billed. Reading and analyzing all of this documentation is known as abstracting. Abstracting is the skill of reading a medical note and pulling out only the relevant details needed for coding while ignoring the conversational filler. When you take the exam, you will face long patient charts that contain a lot of distracting information. Your goal is to quickly scan the document, identify the primary reason for the visit, locate all procedures performed, and verify the medical necessity. Mastering the abstracting process is the secret to finishing your certification exam on time. Finally, you must understand how electronic health records impact physician documentation. Most clinics today use digital systems that feature copy and paste functions, drop-down menus, and auto-populated templates. While these tools make doctors faster, they can also create massive compliance risks like cloning, where one patient's note looks exactly like another's. For the exam, you should be aware that electronic documentation must still follow all the traditional rules of accuracy and specific medical necessity. Just because a computer generated the note does not automatically make the documentation accurate or complete. Congratulations on completing the first section of your certification journey. You have taken a massive step toward exam readiness by mastering these critical foundations of terminology, anatomy, and documentation structure. Now, I strongly encourage you to complete the attached practice test right away. Working through practice questions immediately after the lesson improves your memory retention and builds your exam readiness by forcing your brain to use the new information. The practice test is included with this lesson, so please take advantage of it to reinforce your active learning. You are doing fantastic, and I look forward to seeing you in the next section where we will tackle diagnostic coding.